Good morning, my name is Michael Uy, and today I will be talking about a total hip replacement. I will discuss what a total hip replacement is, different types of hip replacements, types of implants, when it would be needed, any complications, recovery times, and when a provider should be contacted, as well as some nursing interventions. Hip replacement surgery is a procedure done to remove a hip joint with arthritis and replaces it with an artificial one, or it can be done to treat a mechanical fall. Surgery is meant as a last resort option when all other treatments have failed to manage pain. Hip replacement surgery can be performed two ways, traditionally or minimally invasive technique, the difference being the size of the incision. During the procedure, anesthesia will be administered to the patient to sleep and to also relax their muscles. The doctor then makes an incision along the side of the hip and moves the muscle to expose the hip joint. The ball portion of the joint is then removed and the artificial joint is attached to the thigh bone using cement or other special materials. The doctor then prepares the hip bone by removing any damaged cartilage and attaches the replacement socket. The ball of the artificial thigh bone is then inserted into the socket. A drain may also be necessary to drain any fluid that is present. After all is done, the incision is then closed.
I've fallen and I can't get up.
A hip replacement would generally be needed if someone has had a mechanical fall, if the pain in the hip is severe enough to hinder someone's daily routines and interferes with things that they need to do. A hip replacement would be needed when medicinal and all non-surgical options and ambulation aids have failed to relieve the pain. Some signs that might indicate a hip replacement is needed are hips are aching during and after an exercise, when the hips become stiff from sitting, pain prevents sleep, hips appear swollen or are stiff, decreased hip mobility, pain is persistent, etc. A reference to an orthopedic surgeon may be recommended by your provider. Hip replacement surgery is also not appropriate if an infection is present, if there's not enough bone, or if the bones are not strong enough to support an artificial hip. Before all of this, however, a diagnosis will first be performed. During a diagnosis, an orthopedic surgeon will thoroughly examine the patient's hips, analyze any x-rays, and also conduct physical assessments. The surgeon will also ask if there has been previous or other joint pains, ask for a description of the experienced pain, and if there has been any injury to cause the current hip condition. With hip replacements comes along different types of replacements. Types of replacements include partial hip replacement, hip resurfacing, bilateral, staged hip replacement, and total hip replacement being the main topic that I would like to cover. Partial hip replacement is when only the femoral head is removed then replaced. Unlike a total hip replacement, the socket does not need to be removed and only the head of the femur is replaced. This type of hip replacement is meant to treat certain types of hip fractures. Hip resurfacing is meant to help treat pain that is caused from the loss of cartilage. The bone at the top of the thigh bone is shaved and replaced with a metal or ceramic plating. The difference between bilateral and stage hip replacement is the timing. If both hips need to be replaced, the surgeon may choose to do stage hip replacement, in which one side is replaced at a time, letting the patient recover. And bilateral is when both hips are replaced at the same time. However, bilateral may not work for all patients. Lastly is total hip replacement. Total hip replacement, also called total hip arthroplasty, is the most common type of hip replacement. The femoral head is replaced with a metal head, and the socket is replaced with a metal socket. The socket may be held into place by either screws or cement. Just like how there are different types of hip replacements, there are also different types of implants that can be used. The main difference between implants can be the size and the materials that is used to make the implant. Different types of implants include metal on polyethylene, metal on metal, ceramic on polyethylene, ceramic on ceramic, and ceramic on metal. Metal on polyethylene being the most common implant is when the ball is metal and the socket is polyethylene. However, this can produce plastic debris which can then lead to a condition called osteolysis. Next is metal on metal. As the name implies, this is when both the ball and socket are made out of metal. However, this also sheds metal debris which can lead to multiple health issues, with metallosis being one of them. Ceramic on polyethylene is when the head is made of ceramic and the socket is polyethylene. This too can lead to osteolysis. Ceramic on ceramic is when the ball and socket are both lined with ceramic, with the most common failure being the loosening of the components and that the components can fracture. Lastly is ceramic on metal. Ceramic on metal is relatively new and is when the ball is made of ceramic and the socket is made out of metal. With total hip replacement surgery, there are some risks or complications that are involved. Some examples are blood clots, infections, fractures, dislocations, a change in leg length, loosening of implants, and nerve damage. Blood clots can form in the leg veins after surgery. This is dangerous because the clot can travel to your heart or lungs. To prevent this from occurring, the provider may prescribe a blood thinner. An infection can occur near the new hip or at the surface of the incision. Antibiotics are mainly used to treat infections. However, if there's an incision at the new hip, surgery will be required to replace the hip and remove the infection. During surgery, there's a chance that the healthy portions of the hip may fracture. The fracture may be small enough to self-heal, or it can be large enough to require screws, wires, metal plates, etc. to stabilize the fracture. Dislocations can be caused by certain positions after surgery. The ball of the new hip dislocates from the new socket, mainly a few months after surgery. To prevent this, a bracer might be prescribed to keep the hip in the proper position. A change in leg length is sometimes caused by contractures of muscles around the hip. Surgeons take precautions to avoid this from happening. Loosening is a rare occurrence, but this is when the new hip either loosens over time or is not solidly fixed to the bone. Lastly is nerve damage. This is also a rare occurrence, but this is when the nerves are damaged from where the implant is placed. Some nursing interventions for post-operative patients include preventing dislocation of the new hip, avoiding deep vein thrombosis, interventions for excessive wound drainage, how to avoid infections, and physical therapy. Nursing interventions to prevent dislocation of the new hip include educating the patient not to sit down too low or to cross their legs. The hip should not be flexed more than 45 to 60 degrees. Remind the patient not to sleep on the operated side until allowed to by the surgeon. Do not flex the operated hip, etc. Interventions to avoid deep vein thrombosis include education on some simple range of motion exercises that the patient can do to promote circulation. Monitoring of the patient's blood thinner will most likely be prescribed, and simple ambulation can help the patient not only avoid clotting, but it can also help strengthen their leg muscles. Interventions for possible wound drainage include using a portable suction to drain any drainage that has accumulated at the wound site, notifying the provider if the drainage is more than expected, Expected amount of drainage should be around 200 to 500 milliliters in the first 24 hours. Lastly, auto transfusion devices can be used to homologous blood transfusions. Interventions to avoid infections would be administering antibiotics and avoiding any sources of infections. Changing the wound dressing as needed and changing the bed linings can help avoid potential infections. In some serious cases, surgery may be required to remove the infection and replace a new hip, since it might also be infected. Some exercises for physical therapy might include glute squeezes, ankle pumps, quad squeezes, etc. These exercises should be doable by the patient at around 6 weeks. These exercises can help the patient strengthen their muscle and get used to the new hip. Recovery time from surgery is different from person to person. However, activities generally resume at around 10 to 12 weeks. Although it may take 6 to 12 months for a full recovery, the implants can last for 20 years. During the recovery time, it is important that the patient does not rush themselves and is focused on strengthening their muscle and improving their balance during exercise. At the day of surgery, the operation will take about 2 to 3 hours and about 2 more hours to recover from the anesthesia. At 1 to 2 days after surgery, you will need assistance to get out of bed. However, you will be able to use a walker or crutches. The physical therapist will show you how to avoid pain while moving, but other movements may be impossible for a few weeks. You will also go back to a normal diet. 3 to 4 days after surgery, pain should be manageable and you should be able to use the restroom without assistance. You will also be discharged from the hospital if there are no complications. 4 to 10 days after surgery, this is the time where you must avoid infections. Here, the doctor will provide instructions on how to care for your incision, and the incision must be kept dry until the surgical staples are removed. Range of motion is also important as to avoid stiffness and promote circulation. 10 to 14 days after surgery, the staples are then removed and are able to resume a normal shower. You will be able to walk without a cane, and at 3 to 6 weeks after surgery, light activities may resume and walkers and crutches are no longer needed. Regular activities resume at around 10 to 12 weeks, but will take 6 to 12 months to fully recover. Pain also usually goes away during this time. When discharged from the hospital, directions from your provider should be followed. Instructions will be given for home care, incision care, moving safely, sitting and sleeping, as well as a follow-up. However, there are a few things that would require you to either notify your provider or dial 911 immediately. 911 should be dialed immediately if the patient experiences chest pain or shortness of breath. On the other hand, the provider must be notified immediately if the patient experiences a foul smell coming from the incision, shaking chills, a fever greater than 100.4 degrees Fahrenheit, if the pain in the hip increases, tenderness or redness in the calf, if there is swelling or redness at the incision site, or if the incision has opened up, also known as dehiscence. That is all for this presentation, and I hope you have an amazing day.